patients can develop a sense of what are they using food for? What is it treating? What is it managing? It might be how you manage stress. It might be how you reward yourself at the end of a week. It might be how you celebrate with your friends. So looking at that and then figuring out those needs are not magically going to go away. You're still going to need to celebrate life. You're still going to want to reward yourself. You're still going to deal with stress. So the more people can be aware in advance of what they're using food for, then they can really be mindful and proactive about what they're going to trade it out for. So if you're using food for stress, I want you to be really careful that you don't slip into, having wine at night after dinner rather than snacking because it's fitting the bill. That you're being really mindful about saying, hey, I need to unwind. And so I'm going to take an hour after dinner. Maybe it's exercise. Maybe it's that I go sit in the backyard and I, watch the dog play with the squirrels in the tree or, whatever it is for you. But the more you can be intentional about that transfer, the better. And then to your point, it's really hard to say where that line is of, where does the what you've transferred to become problematic or become addictive. And I would say, generally speaking, we define things like that as, is it interfering with your life in some way? Is your spouse upset that every single night you're at the gym instead of, ever having family time in the evening? Are you spending more money on clothes than you can really afford to do? Drinking is a big one that can come into play after this surgery that I really warn people in advance about just being really mindful of and really having kind of rules set up for yourself about how often you're going to be drinking, how much you're going to be drinking, if you do choose to drink, because it can, based on the way your stomach is going to handle and metabolize alcohol, it can become a really big problem for people.